And first of all, I wanted really to thank you all for being here. It is really great to see you. And for Germany, I think I can say that this summit has been of great importance. And I also want to congratulate, we are just in the beginning, I want to congratulate the organizers. I think also this new setting is fantastic. So really looking forward for the next couple of days to address important issue. And one important issue, of course, is the question of AI. Because just a few weeks ago, Nobel Prize winner Demis Hassabis said in an interview, and I quote him, "AI will be 10 times bigger than the Industrial Revolution and maybe 10 times faster." As The Guardian pointed out, Hassabis' Nobel Prize in Chemistry demonstrated what AI already can achieve. With his research, he was able to predict the structures of proteins, the very building blocks of our life. This innovation can open the door to countless medical advances that will reshape the way we live. But just like the Industrial Revolution, opportunities come with risks. Misuse, bias, and the unintended consequences could undermine patient safety, and also very important to address here, public confidence. This means, ladies and gentlemen, we must carefully consider governance, we must carefully consider ethics and trust as we integrate AI into our health systems. With this in mind, let's look at 2 examples of how AI and health go together in practice. In many of Germany's partner countries, AI-supported diagnostic tools are transforming the way healthcare is delivered. With the help of AI, doctors can detect cancer much earlier, giving patients faster access to life-saving treatment. One of our partner countries as BMZ is Cambodia. In Cambodia, BMZ has supported a project that uses AI to improve the diagnostic of cervical cancer. This is making an important contribution to women's health. More than 10,000 women have already been screened for cervical cancer under this initiative. And simultaneously, AI is changing the way countries manage their health systems. Both governments and international organizations in global health, we know that, unfortunately, are under fiscal pressure. That will also be addressed here in Berlin. But there is also an opportunity, I mentioned that. Digital health and especially AI can help countries to work more efficiently and to make most of the limited resources. I want, with your permission, add another example of our development cooperation. So take Nepal, where BMZ is supporting the development of an AI module in Open IMIS. This is a digital system that manages health financing. And this AI-powered system accelerates the processing of health insurance claims. And this means that patients get replies more quickly and insurance companies save money on the administration. And all this, ladies and gentlemen, dear colleagues, shows AI is not just a promise for the future. It is already saving lives, improving efficiency, and reducing healthcare costs today. But as I mentioned in the beginning, there are also risks associated with AI in the healthcare sector, and we need to use the World Health Summit here to address them as well. Imagine a pregnant woman in a rural village who has been waiting for medical advice for a long time. Finally, she receives medical advice. Finally, she receives her diagnosis on her phone, maybe through an AI-powered chatbot. And for a moment, this fills her with confidence. She can access healthcare without long-distance travel or high costs. But the diagnosis is based on data trained maybe thousands of miles away, in a context very different from her own. The treatment recommended is either unavailable in her country or potentially harmful for her unborn child. Or which is also very likely, unfortunately, it costs more than her family makes in a year. So, ladies and gentlemen, if AI is misused or poorly regulated, or if it uses the wrong data, it can produce biased diagnosis or offer incorrect treatment advice. It can ultimately put patients also at risk. And those risks go beyond individual patients. They also affect global equality. Because, ladies and gentlemen, unequal access to AI can deepen existing disparities between countries and regions, leaving vulnerable population even further behind. And I think we all agree, we cannot allow this to happen. Every country and every patient must have the opportunity to benefit from safe AI in health. Moving forward, this requires partnership. That's the philosophy of what we have been doing with our partners over many, many years. Firstly, governments and the private sector must cooperate to make AI safe, fair, and accountable. Clear standards and robust oversight are essential, not only for the safety of patients. They also allow companies to confidently invest in the development of AI softwares in countries worldwide. And secondly, since AI in healthcare is advancing globally, multilateral cooperation is key. Only then can innovations benefit all countries and meet shared ethical and safety standards. So BMZ supports international partnerships. For example, with Africa CDC, we just had an excellent meeting, and I'm happy that you joined the stage. And we partner, of course, with the World Health Organization to strengthen regulatory systems for AI in health worldwide. Non-state actors like HealthAI are also very crucial and play a critical role in these efforts. They help countries and regulators to ensure safe and ethical market access for AI innovations. So HealthAI is the trusted partner of BMZ. And I would like to commend you for your vital work that you are doing and for co-hosting this panel here today. I also want to give a big thank to all of you, our distinguished panelists here, for enriching today's discussion with your invaluable experience and diverse perspective. I think the discussion could not be more timely, and it's great that we are having this first big public discussion on this issue here today. And I think also patients will listen very attentively with their expectation toward us, because it's our responsibility to deliver. So thank you all very much, and back to you. And thank you also here. Thank you.
Thank you, State Secretary.